All righty. Well, welcome back from break, everybody. We have Andrea here from Molina who's going to be joining us for our next section here. Andrea, really no rules here on how to do this. Just we do have you for an hour slot. So you can take anything under an hour up to an hour, anything in between there. But we're super excited to have you with us. I will stop sharing my screen so you can start sharing. And then yeah, you're really good to go. The floor is yours. We use a Q&A chat here. Similar as I've been asking guys, we just ask that you keep the Q&A to questions specifically. Don't be using it as a chat board, all that fun stuff. And then Andrea, it's fully up to you. You can either answer the Q&A as you're going, or you can just leave it towards the end and we can kind of jump in there and answer that, whatever your flow is, okay?
Okay, well, thank you so much. Thank you for having me today. Compliments to the DJ. I love the music. So
Thank you.
awesome. Very lively. I like that. But yeah, thank you so much for your time. I know that you guys have lots of training, so I really do appreciate you taking the time to listen today to our updates. We have lots of information because so much is changing for 2026. So I'm going to do my best to get through all of the updates and get to your questions at the very end, just because I do have a lot of slides. And again, I'm going to try my best to get through everything pretty quickly. And if you have any questions, I'll make sure that the team shares my contact information and the slide deck so that you can follow up with any questions because I'd love to connect with you after the training. So let's get started. My name is Andrea Espinoza. I am the broker channel manager for California and Nevada for IFP. Again, would love to connect with you if you have any questions. If you're interested in selling in specific markets, I can connect you. We have a rep for every one of our states, which is great. So we always have local representation. So again, I can connect you. And then we always got to start with a little bit about Molina. We are a Fortune 500 company currently ranked at 125th. As of March 2024, we serve over 5 million members across 21 states. So very exciting, and we hope to continue to grow. I know, again, it's a challenging environment, this open enrollment. There's a lot that is still up in the air, but we hope to be here for the long run. And then, of course, have to share some important dates for open enrollment. I'm sure you guys are all well aware, but if you do write in multiple states, we always like to add in the dates here as an overall reminder. And then the Shop and Compare tool is open for Idaho, and the Nevada Health link, I've already gone on there, kind of played around to look at the 2026 plans. And then for California, they did push the active renewals from October 1st to October 15th. Again, I think they're really hoping that the enhanced tax premium credits are going to be extended past 2020, 2025. That is the hope that they will. It's not looking too great, but I think everybody's just kind of waiting, and Covered California is one of those exchanges that has made two different scenarios to prepare in case that the extra subsidies are not extended and not approved for 2026 versus if they are. So I think that's why they've delayed some of their activities and the active renewals, kind of waiting to see what will happen. I know some folks are more hopeful than others on that end, but just wanted to share those dates. And then a look at our national footprint. Molina is strategically expanding and redefining the marketplace footprint to maximize enrollment opportunities and strengthen competitive positioning. And this is to ensure long-term sustainability, especially in a market where there's so much that is unknown. It's changed a lot for this open enrollment. Molina is going to be adding 11 counties to its footprint and a new state, Connecticut. We are also exiting 110 counties. This is going to allow us to kind of recalibrate and focus on high-performing regions versus regions where we've had some issues. And so in the next couple of slides, I'll cover each of the states. And then first, we're going to start off with California. Our California footprint will remain the same for 2026. We are going to be in a total of 6 counties: Imperial, LA, Orange County, Riverside, San Bernardino, and San Diego. And then we're going to take a look at a benefits at a glance. This is a really popular document that our brokers ask us about every year. They look forward to the updates. They can see the changes for every plan year. It has the metal tiers side by side. So I always like to reference this really quickly when talking specifically about California too. Um, as you know, the enhanced premium tax credits are set to expire at the end of 2025. This will cause an increase in premiums for 2026 and may cause some folks to move either to a bronze plan. There's going to be more people in the shop and compare tool looking for a lower cost option, and some may even go uninsured, which is a really scary reality. And I think, that's why now more than ever, carriers are really looking at their product design, at cost, because there's so much uncertainty in the market. If healthy people start leaving, they are concerned about acuity increasing in the risk pool and what that's going to look like. Again, I think Molina is taking the stance of kind of just taking a step back to seeing what's going to happen for 2026, letting the dust settle, and then re-entering for 2027. Um, so we'll see. And then for 2025, deductibles were removed for the Silver 87 and the Silver 73 plans. So we saw a lot of folks migrating over from a bronze or a Silver 70 over to a Silver 87 or a Silver 73. But unfortunately for 2026, the deductibles are back. I highlighted them here in that red box for the Silver 87 and the Silver 73. So just wanted to call out the main differences for this coming open enrollment. And then very quickly talk about pricing. We're lucky that in California we do get pricing early. So I'll focus really on where we're going to be the most competitive. The focus overall for Molina for 2026 is going to be retention. We don't think we're going to be competitive in a lot of our markets, given just the overall rate increases and then what's happening on the subsidy side. I think a combination of that is going to cause just a lot of membership changes overall. So our focus is really retention and keeping the members that we have because that's the business that we know. So first off is Imperial County. We're going to be the lowest cost across the board for silver, gold, and platinum plans. And then third in bronze. Next is Region 17, which is the Riverside and San Bernardino County. San Bernardino County is our largest county in California. We are going to be second lowest cost in silver there, and then lowest cost in platinum, gold, and bronze plans. I see a lot of opportunity in these counties. We don't have a lot of writing agents. So if you are close to that county interested, I think that's a county with a lot of potential. We have a lot of folks migrating and moving over to these counties, buying homes here. I'm from Riverside County myself, so there's a lot of opportunity there. We also don't have any major agencies. So again, big opportunity. And we're going to have a lot of folks that are no longer going to qualify for Medicaid that are going to be moving into ACA plans. And then next is San Diego County. We are going to be the second lowest cost gold and silver across the board. This is where a majority of our membership lies for California. So again, our goal is going to be retention. We are keeping all of our major hospitals and medical groups, including Scripps in network, which is really great. So no major changes there. And then next is Region 16, which is our West LA region. We are going to be the second lowest cost silver, and then third in the platinum, gold, and bronze plans. Again, no major changes to our network, which is great. I think overall in the LA region, a barrier is usually LA Care is the lowest cost across the board. They also are, though, that oversee the Medicaid program. So year over year, they're the lowest cost. But thankfully, we are coming in second for silver. So hopefully we can keep most of our membership there. And then next we do have Region 18. That is Orange County and Region 15, East LA. Historically, we haven't been as competitive in these regions. But we are going to be fourth in silver for Orange County and third in silver for East LA. So again, not as competitive in those regions. All right, and then next we have Connecticut. This is a new state for us. Molina acquired Connecticut, and we are very happy to expand to a new state. The company will continue to operate under the Connecticut banner. So if you do write business there, please feel free to reach out to our broker support unit. These plans are available through the state-based exchange Access Health Connecticut. And then a little bit more about our company that we've acquired. So Connecticut does offer two product lines under Marketplace. They have the Connecticut Benefits. This is the Choice Network. These plans offer a larger Connecticut provider network. There's also a variety of plans, as you can see here on that chart, 3 bronze, 1 silver, 2 gold, and 1 catastrophic plan. And then there's a second product line known as the Value Network under Connecticut Insurance Company, Inc. This offers a narrower Connecticut provider network, and consumers can select from 2 bronze plans, 1 silver, or 1 gold. And there's also a off-exchange plan that is available through direct enrollment. All choice and value plans, non-CSR, are available through the off-exchange and on-exchange. And then additionally, there are 3 solo plans that include access to New York providers. If you're interested in learning more about Connecticut, I can connect you to the broker rep there. So please let us know. Again, lots of really good information for Connecticut. We don't think we're going to be competitive for 2026, but again, if you do write in that state and you are interested, please let us know. And then Florida, we are expanding to 3 counties, Marion, Lake, and Collier. Those are highlighted in yellow on this map. These were areas where we've identified high potential markets where we can grow. For Florida, we don't have an idea yet of how competitive we are going to be, but again, our focus is going to be retention. And then we have Idaho. No changes in the footprint there, a total of 7 counties. We do think we're going to be competitive on the gold plans, again, depending on the county/service area, but no changes to our network. And then next we have Illinois. Get Covered Illinois is going to transition to a state-based exchange this November. According to everything we've read, we are working through those updates and how to implement those changes. So fingers crossed, all that won't be as bumpy to get that implemented. We do have a strong network in this state. We added Advocate Healthcare. And we're going to continue our partnership with Rush University System. So no changes on that end. And then next we have Kentucky. Historically, this has been a challenging state, I think, overall for all agents in the way that it functions. But we, due to all of, because it's been so bumpy, we are exiting a total of 25 counties for 2026. We are expanding into 1 county, Bourbon County. We don't expect to be competitive this OEP given the landscape. But we are taking a step back just to focus on provider partnerships, member experience, and then hopefully re-enter these markets in 2027. Okay, and then next we have Michigan. We are exiting all of our counties in Michigan, and we are completely moving off exchange for this state. This is going to allow us to reassess the market as we've had some challenges in Michigan too. Again, we are hoping to re-enter in 2027. And then moving on to Mississippi, no changes in footprint. We're going to continue to be statewide in Mississippi. We do expect an increase in premiums. Our preliminary rate change there was 39%. And then, of course, if you couple that with the possibility of the enhanced tax premium credits going away for 2026, that can have an added effect, making it less affordable overall for folks there. And then for Nevada, for 2026, we are reducing our footprint. We are exiting Douglas, Lyons, Story, and Carson City. These were rural counties that we had not a lot of membership, so it's very minimal impact. So instead, we're going to move to optimize service around the Las Vegas and Reno areas just to ensure better network alignment. That is definitely a focus for us for this year, is looking at all of our provider contracts and making sure network adequacy is at the top before expanding into any new counties or any new territories. And again, I did take a look at the shop and compare tool for Nevada, and we continue to have some pricing challenges for 2026, but hope to be competitive for 2027. Definitely the plans that we sold, we've talked to those members, and what they really enjoyed was having no referral needed for a PCP or specialist. So that was awesome. We're going to continue to have that for 2026. And then for New Mexico, we will continue to be statewide. We are expecting to be competitive statewide in New Mexico. Something to note for this state is New Mexico's Healthcare Affordability Fund will cover the loss of the enhanced premium tax credits for households with incomes under the 400 FPL. At least that is what is being reported now, and this can help reduce the impact of the potential end of those enhanced tax premiums. So great that New Mexico has this fund as this added protection. So again, we hope that this added protection will help folks keep their insurance and will have more shopping around, and they won't feel the effects of the increases overall. And then we have Ohio. For Ohio, we're expanding into Hardin and Carroll County. We do expect changes in membership here, as we've seen some pretty big rate increases across the board for all the carriers. But again, we won't know until November 1st when the pricing is available. And then South Carolina, we are exiting 8 counties here: Anderson, Georgetown, Greenville, Horry, Lawrence, Orangeburg, Pickens, and Spartanburg. Those are the changes for South Carolina. Again, no information yet on pricing, but sharing the changes in our footprint. And then on to the great state of Texas. There's some major changes to our footprint here. Texas is one of my favorite states, so bummed out about the changes. We're adding some counties around the Dallas-Fort Worth area to serve more members. However, we are exiting Rio Grande Valley area, Bexar and Harris County. Pretty bummed out about the changes overall in our footprint. But again, they're reassessing for this open enrollment and taking a look at what's going to happen to the market, and then hopefully re-entering these regions for 2027. And then we have Utah. We've reduced our footprint here. We are now only in Iron and Washington County. We're exiting a total of 11 counties. And this is going to allow us to really focus on where we're most successful and where most of our membership is in Utah. And then no changes in our network here. And then for Washington, no changes to our footprint in terms of pricing. The average rate change was about 28%, at least on our end, and that's really on the higher end. So again, there's probably going to be some impact there on overall premium increases. And then lastly, we have Wisconsin. We're going to be exiting all counties for Wisconsin and completely moving off exchange and then reassessing again for 2027. And then on to some member resources. We've got the Molina Member Wellness Program, now known as the Molina Healthy Rewards. And this gives members access to interactive programs to manage their asthma, heart disease, depression, diabetes, among other prevalent issues. There is a $200 gift card incentive that is available to members if they complete their online wellness assessment and their annual routine physical exam. To participate, members can sign up through their My Molina member portal. It is completely free for members 18 years or older. Again, if they're already going to be doing their routine physical exam, why not complete their online assessment and receive a gift card? Just a quick note, it is $150 for California, 100 for Washington, so it does vary by state, but it's very easy to sign up. If they do it through their My Molina portal, it tracks the points. It lets them know when they've completed all the activities, and then they can select from different vendors for that gift card, including Visa, and then it automatically gives them the information on how to redeem that gift card. So again, really easy to utilize, easy steps. If you have any questions on how to utilize the program, if maybe you've had folks that have completed all the steps and don't know how to locate their gift card, please let us know. We'd be more than happy to help. And then next is our member portal and mobile app. My Molina is super easy to navigate, secure. Members have access to their digital member ID cards, premium payments, medical records, and PCP changes. Everything is in one convenient place. I think we get lots of calls around PCP changes. So again, members can self-service through the member portal. And then next is they didn't receive their member ID card or they've lost it. Again, if they create a My Molina account, they'll have access to a digital copy of their member ID. So really handy for them to have that. Again, really easy instead of them having to call you or have to call our member services department, they have direct access to that information. And then the app is available in Android and Apple in English and in Spanish. So really easy. And then, of course, if members have any questions about their policy or any care questions, we do have our member services department that is ready to assist. So we added the phone numbers here. And then we can't talk about open enrollment without discussing payment options. We want to make sure that members effectuate their coverage. You guys work so hard to enroll them, so we want to make it as easy as possible for members to make their premium payments. As you can see here, we have tons of options for all of the members. The preferred option, of course, is auto pay, but we know that that's not a possibility for all of the members. So we do have the bill matrix option. That is a one-time payment option. Members don't need to make any kind of account. This is, I would say, the preferred method that a lot of members and brokers help their members utilize. And they do have the option of Apple Pay and Google Pay. They can also pay by phone, by mail, MoneyGram, or check pay in counties here in California, like Imperial. We have lots of members that don't have bank accounts, so it's great that they do have the option to make payments in cash. So again, making sure that members have as many options as possible to make their payments. If members are wondering how to make a payment, or maybe they're new to Molina and they would like information on how to read their member statement. If they would like to start, stop auto pay, anything like that, we do have a dedicated team for just enrollment and premium billing information. And then really exciting, we do have a new payment option. Agents can now make payments directly on the broker portal. I think that just went live yesterday, so very excited to be able to announce that. Again, super easy. An agent can log in right where you check your book of business. Next to the member, there'll be a make a payment button. You'll select that, and then it will send the member an authorization code via email or text that they'll have to give you. So again, very important that the member opts into this. And then you can also set up auto pay for your clients. There's going to be trainings available directly for this new option. But if you do have any questions or if you want to give it a try, let us know how it goes. We'd be more than happy to hear from you. So again, very excited to be able to continue to add new functions and options to our broker portal. And then some quick benefit information and what's new for 2026. We've updated our branding, very exciting. Last year, we tested out a new way of naming our plans. For example, the Molina Silver 12 with free 4 PCP visits. That name worked really well. It was clear, easy to understand, and it highlighted the value that members are getting. For 2026, we're taking that approach across all of our marketplace plans. And the idea is pretty simple. We start with the brand name, Molina Marketplace. We add the metal tier like bronze, silver, gold. And then we add a sub-name like value, saver, essential to highlight the type of plan. And then we call out the benefit, whether that's a free PCP visit, low deductible, so that consumers immediately know what makes the plan so valuable. And this is going to make it easier for you as the broker to sell and for the member to understand what they're getting, while also helping guide them towards the right plan for their needs. So instead of just confusing numbers and codes, people will see something like Molina Marketplace, Silver Saver. Again, making it simple, clear, and focused on benefits. So as you can see here, we do have a list of the sub-brands and what each of them means, whether it's value, saver, core, smart, access, premier, enhanced, or plus. And this is a high-level overview of our plan offerings. First, you'll see our FFM states, and next, the state-based exchanges. On the right-hand side, you will see what they were called in 2025. So Gold 1, Gold 8, Silver 1, right? But that didn't really tell you much about the plan. And next to that, you'll see the 2026 plan name, which will give you a lot more information about what kind of plan you are selecting. And then as you can see here, you'll have the gold followed by the silver plans and then the bronze. And then what you see labeled as Empower is usually an off-exchange plan, also highlighted in purple. So again, a really easy, helpful chart, especially if you're selling in multiple states. It really lets you see what products are available. And again, we'll be sure that you get a copy of this slide deck so that you do have this with you as open enrollment starts. All right. And the next slide. In 2026, Molina is also launching a heart healthy strategy. This is going to focus on members with congestive heart failure. And the goal is to improve outcomes and reduce costs through smarter targeted plan designs. The plan lineup is going to include gold, silver, and bronze variants, and it's going to focus around congestive heart failure. The gold and silver plans will feature lower specialist copays for cardiologists, $0 generic, and reduced cost for brand name drugs. And of course, it's going to enhance the rehab and diagnostic benefits. These plans will only be available in Ohio, and it's just kind of a way of us launching, seeing how it's going to do. And we hope that this approach is going to strengthen just care coordination and improve member outcomes. So again, this slide has just a lot of information of each of the plans that are available and the savings. And again, the plan design is completely around congestive heart failure. Okay, and then this is just a quick look at our plan design for bronze. This is a very detailed breakdown of each of the plans. Sorry, and the benefits for each and out-of-pocket costs. And then next we have the silver plans. A lot of focus around the silver 12, which has a free 4 PCP visits, and the silver 1, and then letting you know which ones are new. And again, those plans highlighted in purple are off exchange. The way that these were organized is you see the ones that are light silver are usually at a lower premium, higher out of pocket. And then those in the darker silver, richer benefits, but usually cost a little bit more. And then we have the gold plans. Again, same idea. At the top is the gold 12, a very popular option. And then the core gold, $1,640 deductible, another popular option. Again, lower premium at the top, but higher out-of-pocket costs, and then richer benefits, but at a higher premium. And at the bottom here, you'll see the gold off exchange, and they'll all be named Empower, and that's how you'll know they'll be off exchange. And then it'll give you a guide of what's available for each of the states. And then just something to keep in mind. All of our plans do offer value basics, so that includes 24/7 telehealth, virtual care, including mental health services, no-cost preventive prescription drugs, preventive screening for children and adults, pediatric vision services, and 24/7 advice line. And here's a little bit more about Teladoc. That includes mental health 24/7. That's been a really popular option. So folks, if they don't want to leave their home, from the comfort of their home, they can reach mental health services. So very happy to be able to have added that for 2025 and no extra cost. And then, of course, we also have added adult dental benefits from Delta Dental, which is our vendor. Members can now select medical plans with embedded dental services with no separate dental plan required, which is huge. This will apply to Florida, Illinois, Idaho, Kentucky, Ohio, South Carolina, Texas, and Utah specifically. And it includes preventive care, diagnostic services, and major services like root canals. So again, this is awesome, available in 8 states from our vendor, Delta Dental. And of course, vision, we do have adult vision plans that are available for purchase for our Silver 1 and Silver Gold plans. And of course, this will include routine vision, comprehension vision exams, lenses, contact lenses. And then we did include a link here for our in-network provider list for a VSP, which is our vendor for vision plans. And then just a quick look at our off exchange. I won't go through each one of these, but we do have a robust offering for off exchange design, as you can see here. Again, each of them are Molina and Power, and then it'll have the metal tier and then the deductible right next to that. And then, of course, our off exchange offerings will be available through Health Sherpa. As you go on there and quote, you can select to quote on exchange or off exchange. Of course, we always say quote on exchange so that the members can take advantage of those subsidies. Now, if they don't qualify for any subsidies, then they can maybe go on off exchange and get some savings that way. But again, that is available directly through Health Sherpa. And then if you do need to find an in-network provider, whether that be a PCP, specialist, hospital, That is available through our online directory. Please check the online directory before enrolling members to verify that they are in network. If there is a PCP, a specialist, a hospital that you're not seeing, please send us a message. I'd be more than happy to verify that they're in network for you, because I know that it is very important for members to verify providers before enrolling. So I'd be more than happy to check that for you. And then just some quick broker resources. This is our Molina benefits flyer. We do have the Molina marketing store that is available for all agents. You can go on there, use your NPN, sign in, and you can actually have these forms sent over to you. So they'll be printed and sent to your office or to your home. So that is available. And there's different forms and materials that are available for you to order. So please take advantage of that. And then we do have our benefits brochure for 2026 and our benefits at a glance again for each of our states. And then we do have our Molina Marketplace website that is available if you need anything. All of the resources that I discussed today are directly available on there. Something that's really popular too is a drug formulary. We get a lot of questions around that, so that's available through our website. And then you can also access the broker portal there. We do have a dedicated team that is ready to assist you if you have any questions, whether that be access to care issues, PCP, contracting, commissions. Any questions that you might have, you can contact them directly and they'd be more than happy to assist you. You can reach them by phone or by email. And then, of course, because it is OEP season, we do have to have the OEP readiness checklist. Make sure that you're in ready to sell status. You've, of course, attended your trainings, making sure you've completed all your certification and that you've declared all the states you want to sell in. So please take a moment to log into your broker portal and make sure that you're in ready to sell status, that you've selected your states. We want to make sure that you'll receive commissions and bonuses. So very important that you're in ready to sell status. And then I did talk about our broker portal. So if you want to make payments, if you want to look at your book of business, very important that you do have access to your broker portal, that we have your most up-to-date email address on file. So please send us a message or reach out to our broker support team so that they can confirm or assist you with making sure that you can log into your broker portal before OEP starts. And super handy, you can look at your book of business. We've kind of made some really great updates to the portal that you'll be able to see as you log in. You'll be able to see paid through dates, if they are pending termination, in grace period. So very important that you are checking your book of business. And then you can also make PCP changes and order ID cards directly on the portal. Again, we added a QR code here so that you can get directly connected to that website. And then very excited, we are expanding our team. We have a new director that is for Off Exchange and ICRA sales, specifically Dennis. I'm sure you've probably heard of him. And then we did add some more reps, especially for Connecticut, Nancy and Deanna, that are available to assist you. And we added their contact information. Again, if you want to get connected to specific folks, send me a message and I'd be happy to assist. And that is it for me. Just want to thank you so much for your time. I hope you have a very successful open enrollment. I know that these are definitely some challenging times and there's so much confusion and so much that's still up in the air. But Molina's here for the long run, and we're gonna wait for the dust to settle and then see what the future brings. But I want to thank you so much for your business and for being such a great partner. If you need anything, please reach out.
Thank you so much, Andrea. We really, really, really appreciate your time, all your information, and thank you again for stopping by.
Yeah, of course. Thank you so much, guys.
All right, guys. So what we're gonna do now is we're gonna take another quick break. We will come back at the turn of the hour. So we will take a 20-minute break here, and Then we will have Health Sherpa come on, and Health Sherpa will be talking with us about obviously the platform going forward for this open enrollment here with all of our carriers. So thank you again, Andrea. We appreciate you. And then guys, we'll take a quick 20-minute break, throw some music on, and we'll go from there.